Hello and good afternoon. Welcome to Facebook Live with OrthoVirginia. I'm Dr. Stephen Danaceau, an orthopedic surgeon here in Arlington, and I'm a proud part of the OrthoVirginia network, which is the largest orthopedic surgery practice in the state. If you have any friends or family that are interested in this topic, which we will be discussing fracture care, please take a moment to invite them to this Facebook Live event. As you may know, there are many fields of orthopedic surgery. There are shoulder surgery, trauma surgery, shoulder and elbow care, and sports medicine. As background, I've been practicing orthopedics in this area for the past 21 years. My specialty has evolved to be a combination of those fields. I did my training in general trauma fracture care and did my specialty training in shoulder care. As you may know, orthopedic injury can involve any variety of structures. Orthopedic injury can involve bone, tendon, ligament, cartilage, or other soft tissue injury about the body. But today we'll be primarily focusing on bone injury, in particular what happens to a bone when it gets injured. I'll begin by asking my audience about what they think the most common question is we get asked as orthopedic surgeon. Actually, the most common question we get when somebody presents with a bone injury is my bone fractured or broken? To which I reply that it's actually both. They do mean the same thing. That is then followed up with the second most common question, usually from the patient, are you sure, doc, that there is no difference? And I'm here to tell you there is no difference. It is the same thing. This confusion with the wording, I'm not exactly sure where it comes from. I believe some people will confuse what we call a simple fracture versus a more complex fracture. A simple fracture being a bone that's just broken in two pieces versus a more complex fracture, or what we call comminuted. And the other source of confusion could be that people may confuse what is called a closed fracture versus what is a compound fracture. Meaning a compound fracture is one where the bone comes through the skin. We're not here to talk about the history of the confusion. I'm here to talk about how to take care of bone injuries. And so let's go on to discuss how bone injuries can be treated. The bone is quite a unique structure. It is a quite fascinating structure in terms that it can heal itself once it's been disrupted. They do have a unique ability to unite after any specific bone fragments have been separated. This ability is very unique in children. They can break a bone such that they can remodel and reshape it back to its original form. That's why in children we commonly don't need to do surgery as much for their injuries. In adults, we lose a lot of this ability, and the body does try to heal itself in terms of bringing the bone ends back together, but commonly we have to use surgery to help properly align a broken bone to eventually get better function. Today we're here to go over some basic treatment options for fractures about the body. Simple fractures can be treated in a variety of ways. We can actually treat a lot of fractures here in the office. A lot of injuries can also be treated in the emergency room when they are more severe. But here in the office, for example, a common finger fracture can be easily treated with a small finger splint like this, in which the finger is just taped around a properly cut size. We can treat wrist fractures, where just most wrist fractures, as long as it's a hairline fracture or what we call bone contusion, it can be treated in a wrist brace. And then we do have larger devices such as a boot or even ankle fractures that can be treated in the office. Occasionally someone may have to have their ankle fracture or other fracture put into a cast, in which case these are casting tapes. You can wrap around an arm or leg and eventually they do harden. And we do actually have waterproof and cast material where you can actually put a cast on and go swimming. These are some of the basic non-surgical means we use to treat fractures. If for some reason a fracture is not well aligned or it's not healing as we would expect, then we do typically have to go to surgery. And here I've brought some examples of different ways we do fix fractures. Interestingly, treating fractures is not too different than going to the hardware store and getting what you need to fix things. Over here is the basic tray that we typically will use for fracture care. The instrumentation that comes with it is, again, what you might see at any tool store. There's clamps and other devices to help hold bones together. And then we have a variety of plates for different parts of the bone. This one is more for the lower leg around the ankle. And the interesting thing about the plates is they are pre-shaped, pre-contoured to match certain bones, so they do make application a lot easier. When a fracture can't be fixed where we think it will heal back to its normal shape, then that's when we use hardware fixation like this. There are other kinds of hardware fixation, not just plate fixation. I don't have an example, but one common device is called a nail, in which case we do put a metal rod down the middle of a bone, which helps maintain alignment and help the bone heal. But both of these are probably used equally, and they're both generally acceptable. Just some fractures are more amenable to this kind of fixation, others are more amenable to doing a rod. Occasionally, when fractures cannot heal or do not have the good potential to heal, we do a joint replacement. And those fractures are the ones that usually are near a joint, such as a shoulder or a hip. If a shoulder fracture is severe enough, it's in so many pieces, and we will generally go to what is called a shoulder replacement of some sort. This is one kind of shoulder replacement, and then there's still another kind of shoulder replacement that does the same thing in terms of trying to restore the anatomy. And the same thing for a hip, that if the hip fracture is a kind we call a femoral neck fracture, where we don't think it will heal, then we will put it in an artificial hip so that someone can be standing and walking on it relatively quickly. And in a nutshell, that's fracture care. So, if you have any questions about what you can do for your fracture or injury, we'll take them in just a moment.
Yes, we do have some questions that came
Okay.
in, so thank you. So the first question that we have is, the treatment, is it different for the break or the fracture?
The treatment is the same. Again, fracture and break are the same thing. So we decide on whether you can be treated non-surgically or surgically. Non-surgical treatment can include putting on a splint or a cast or a brace, or it can be treated surgically with, for example, again, the plate fixation I showed you, or some other type of device to help stabilize your injury.
Okay. Is a stress fracture a break?
A stress fracture is technically considered a break. The analogy I'll tell people that the bone is in continuity, but a stress fracture is similar to like a crack in a sidewalk. The sidewalk is still intact and not, in a sense, falling apart, and that's what a stress fracture is similar to. You will have a crack in the bone, and the bone is in continuity, but it has not completely broken apart in a way that most people think of as a broken bone.
There's a second part of the stress fracture. If I have a stress fracture in my ankle, can I still walk on it, or do I have to be non-weight bearing?
Stress fracture in the ankle, you can be either, depends which bone is involved. If it's a typical stress fracture in the ankle, what we call a bimalleolar ankle fracture, where it's the inner or the outer ankle, those you can walk on usually with crutches and a boot. But if your ankle fracture involves a talus bone, for example, that more typically is strictly non-weight bearing for usually 6 weeks minimum.
We have another question about the collarbone. I recently fractured my collarbone. Does that require surgery?
That's an interesting topic, and the treatment for that is changing, in particular over the past 5 years. When I was in training, most collarbone fractures were not recommended to be fixed, but pretty recently, in the past 5 to 10 years, it's been shown that significantly displaced collarbone fractures, which we do have criteria for that, do need to be fixed because it does affect long-term function. So the short answer to your question is we are fixing more of them. It just depends how displaced it is and how, in a sense, shortened it is.
Okay, great. Our next question coming in is, after a fracture, do I always have to have physical therapy?
Almost always. We enjoy doing what we do and putting things back together. And to us, it's relatively quick and straightforward. But you, as the patient, have to do an immense amount of physical therapy and rehabilitation to restore all your muscle anatomy and muscle strength around the injury. Though we might say something looks healed and say you need more therapy, people think that's odd because it's healed. I don't need more therapy, but the therapy isn't for fracture anymore. It's to restore you back to your previous level of function.
Okay, perfect. Next question is, I've heard of PRP. Is that something you do, and do you do that for breaks or fractures?
PRP is a type of treatment for other injuries. It's not traditionally done for it. Probably could, but it's not a traditional treatment for fractures.
Okay. When you repair the breaks or fractures, do you ever use cadaver ligaments?
We use cadaver tissue for fractures. More commonly, we will use cadaver bone in case someone has some amount of bone loss that just can't be filled. And it may seem odd that you can lose bone from a fracture, but what happens in some fractures, the bone can be broken up in so many pieces that nothing can be easily put back together, in which case we do use cadaver tissue, which is called allograft. Cadaver ligaments is usually for ligament reconstruction, which is a different topic, and that's more in usually the sports medicine realm. But we do use cadaver ligaments also.
Fantastic. Okay, the next question is, why can't I use a cast instead of surgery?
A cast will immobilize a fracture, so it can heal. The body does a great job of healing. However, if a bone is not aligned properly, a cast will not, it's more in a judgment call. If we don't think a cast is going to hold the bone in proper alignment, then we do recommend surgery to put the bone in proper alignment. So that's why we will recommend a surgery instead of a cast.
Okay, perfect. Looks like the next question we have coming in is a cast if I broke my ankle, is a cast better than a boot?
Again, it can depend on the fracture. For many ankle fractures, a boot can be used as long as it's what we call a stable fracture, which might be a fracture that's a hairline fracture or does not have a significant shift of the bones. If it's more such as a talus fracture, people will more commonly use a cast to completely immobilize the ankle. But you can use either one. It just depends on how severe the fracture is.
Okay. This one made me giggle, I will say. I'm quite old now, and when I was younger, they did a full body cast. Is that still a thing?
Full body cast was probably for a femur fracture as a pediatric patient. And yes, it is still an accepted standard. If it was done when you were older, no, we don't do full body casts probably for anybody over 8 or 9, or probably more like 10 or 11.
Okay, good to know. The next question is, can I have a fracture and not knowing that I'm still walking around and it turns out I do have one? Would it be possible to not ever know?
Most of the time you will know if you have a fracture because the body can sense pain at some point. The only exception to that is, unfortunately, some people with diabetes develop severe neuropathy and they can't feel, for example, things in their feet. So they could be walking on a broken bone and not know it. But the rest of us, as long as our sensation is intact, we will eventually be able to tell if something is broken.
Okay. The next question, and let me make sure I'm saying this right, is you often hear that when an elderly person breaks their hip, it's very detrimental. Is that because a hip break is worse than other breaks, or is that because of age?
It's both. Hip fractures are pretty severe injuries. At least in the past 40 plus years, you don't hear about people having as many ill effects from hip fractures, say, as you did in the 50s, which I know that seems a long time ago, but what I'm comparing it to is back in the 50s, before hip fracture fixation became more developed, a hip fracture had a 90% mortality for anybody, because basically to treat it, you had to put somebody in bed for an extended period for anywhere from 3 months to 6 months. And it was an extremely life-threatening injury back then. Jumping way ahead to now, the numbers have been completely reversed. Instead of what is essentially was a 90% mortality is now less than 10% mortality across the board because of hip fracture fixation. So the point of fixing hip fractures in the elderly, though yes it's a risk, is we fix them so they can get immediately back up on their feet and avoid any other problems that come with bed rest.
Okay, perfect. I recently broke my ankle and got put into a boot. Am I allowed to drive with my boot on?
Technically, by law, no. You're supposed to have all appendages working normally without any hindrance. I know people do, and I get asked that, but I always say that I can't tell you to drive with it, but I am here to tell you that you should take it off for driving.
Perfect.
Unless your injury is so severe and so painful without it, then you shouldn't even be considered, or you shouldn't consider driving at all.
Okay, thank you. The next question is about the cast that you mentioned that was waterproof. Is that for all types of cast? I'm assuming for arm versus leg.
You can do a waterproof cast for just about any body part. Ankle, wrist, elbow, arm. The nice thing about the waterproof cast is they can get wet, and that's why people prefer them. So yes, you can put them on almost any body part.
Okay. Looks like one of the last questions we have coming in is, I recently broke my arm and I was in the cast for about 4 weeks, but one of my friends was in a cast for 6 weeks. Should I have been in a cast longer?
Some fractures can show excellent signs of healing by x-ray, and also clinically you may have had a lot less pain and therefore got out of a cast sooner than your friend. It just depends on the severity of the injury.
Okay. Looks like that was the last one, so I just want to thank you very much for this information. It was very helpful and very insightful.
Thank you. It was my pleasure.